And with summer weather coming back, let's check in with the Erie County Health Commissioner, Dr. Gale Burstein, here to address the importance of covering up to prevent skin cancer. Good morning. Nice to have you back.
Good morning. Yeah, with all the sunny weather that you're forecasting, people have to be careful to protect their skin, against the dangers of ultraviolet radiation and the sun's rays. So we're recommending that everybody lube up with suntan lotion, at least SPF 30. And make sure that you use like a shot glass full to cover your body, and also make sure that your kids are covered, especially their faces. And even if you use the spray, which is really convenient, make sure that you rub it in. And you probably noticed there's a lot of mozzies out right now too, so you also might want to use insect repellent. Yeah. So the way you apply the two together is, I'd avoid buying like a combination product. I would first, lube up with the sunscreen, and then put on the, the insect repellent, and then follow the instructions of reapplying each. But the sunscreen should go on first. And we in the United States see a lot of skin cancer. We have very high rates of melanoma, and it's actually the most common cancer diagnosed in the United States. So we really have to be careful, and especially men in their 50s are the #1 age group and demographic that is diagnosed with skin cancer.
Is that because they just don't, they're working out in the sun and they just don't apply as much as maybe a woman would?
Yeah, that's that could be true, or they might not apply at all or think about it. However, whatever also there could be genetic factors, or differences in gender, the way that people metabolize UV exposure. So there's probably multifactorials, but however, men in their 50s are the #1 demographic of developing skin cancer. It's not to say that women don't develop it too, but men should realize that they're on the hit list.
Yeah, I also understand that tanning has never been more popular.
Yeah, and I'm not sure why. I mean, especially the tanning beds are super dangerous. And I think some people think that they're healthy, like, oh, I should use them so my skin will be tan before I go away to a warm climate, which is actually not true. I mean, it's, very high amounts of radiation exposure, and if anything, you want to, minimize your exposure, not getting more exposure before you go to a very sunny climate, and add to the exposure. So, really, there's nothing good about tanning salons.
Yeah. I also want to bring up the fact that this is a great time of year to be out with your baby. And I'm always wondering, because the babies usually have no shoes and socks on, and they're trying to get as much fresh air as possible, to really lather up that little baby. So, that little tender skin, I just hate seeing it in the sun, and you wonder if they're being protected or not.
Right, yeah, that's a great point. And also when you when you take your baby out, try to keep them covered and in the stroller if it's during peak sun hours.
Yeah, for sure. What kind of medicine do we have for skin cancer? Does it have to be excised? Does it have to be taken out?
Well, I'm not an oncologist, so I can't really answer that. However, you really should go, if you have any lesion that's suspicious, you really should go see your primary care provider or dermatologist to have it assessed. I mean, if a quickly growing a mole or a dark spot, or a spot that is dark and has multiple shades, or it has very irregular edges. I mean, those are very concerning. Also, like a mole that is an area that's not exposed to the sun. I mean, there could be something funky about that too, because like, why did that pop up? So, those are all the type of skin lesions that you'd really want to talk to your primary care provider or dermatologist if you have one already, because it can be very lengthy wait to get an appointment as a new patient with a dermatologist, just because they're such a great resource in our community and they're very high in demand. So primary care providers should be able to refer you to the basics.
You know what? And if you do go to a dermatologist, ask and see if they have skin or a sunblock or sunscreen, because I have found that usually it's a better brand. It's usually something that obviously comes from the doctor's office. It really gives you even more protection than the stuff you can get over the counter.
Right. I think a couple years ago, Consumers Report did a review on the suntan lotions, and they kind of missed the mark on some of the products. They didn't end up working as well as they said they would. So you want to make sure that you get at least an SPF 30. Once you get really high to like 80 or 100, it's really hard to say how much there's really there. So, but somewhere between 30 and 80, depending on the type of your skin. And even people of color are at risk too. I mean, people of color still can get sunburn and develop skin cancer. So really nobody's immune.
Right, absolutely. So with the sun coming out, and I know you feel like, oh, we've waited all year for this. You just got to be smart, and protect your skin. Skin cancer is just something that is avoidable. And you want to do everything you can just to make sure that you're safe. It's not something you want to be told later on that this is something that has spread.
Right, and even a cloudy day, I mean, there's the rays, UV rays are still getting through. So that doesn't mean that you're safe.
Right, and in the winter when you're skiing, so I mean it reflects there too. And also, don't keep sunscreen from year to year. They say you should just get rid of it and buy a new bottle.
Right. I mean, the skiing's a great point. I mean, the worst burns I've ever seen on people have been at ski resorts, right? Because they're like, oh, there's snow, it's cold, I don't need sunscreen.
Right.
But actually, the whiteness of the snow causes a lot of refraction, and you're even more at risk.
So hang on to the sunscreen, but then after a year, get rid of it. Well, it's a beautiful day out there today, so you're going to want to make sure that you have applied, okay? Skin cancer prevention, more information on the doc's website, okay? Erie.gov/health, 2erie.gov/health.